Still in China, and the country's policies and practices to contain the massive surge of COVID infections since the beginning of the pandemic is taking a toll on the environment. Hazmat-suited workers poking plastic swabs down millions of throats in China each day is leaving bins bursting with medical waste. China is the last country in the world that is trying to eliminate COVID, but the spread of the highly contagious Omicron variant is defying its strategy of mass lockdowns and quarantines. COVID-19 lab tests are a permanent feature of daily life in China. Now, according to the World Health Organization, China's zero-COVID strategy is unsustainable. In China's major cities, even where there are no reported cases, residents are being required to present a negative PCR test to go shopping, ride the subway or bus, or participate in public activities. While many countries are now relying on vaccination and improved treatment, China has stuck to its policy of lockdowns and other restrictions. Experts say that this approach is creating tons of hazardous waste every day and a mounting economic burden for local governments who must spend tens of billions of dollars to fund the system. On the one hand, Beijing has positioned itself as an environmental leader. On the other, blanket testing is posing a major trust challenge. Each positive case, usually a few dozen nationwide every day, leaves behind a trail of used test kits, face masks, and personal protective gear. Biomedical waste that is not disposed of properly can contaminate soil and waterways, posing threats to the environment and human health. China has set the goal of making its economy carbon neutral by the year 2060. However, the country's COVID waste problem could make this difficult to achieve, while nationwide data on the waste footprint has not been disclosed. Shanghai officials have said that last month the city produced 68,500 tons of medical waste during its recent COVID lockdown. The daily output was up to 6 times higher than normal. Under Chinese regulations, local authorities are tasked with separating, disinfecting, transporting and storing COVID waste before it is finally disposed of, usually by burning. However, disposal systems in the poorer rural parts of the country are overburdened. Researchers say that because of the huge quantities of waste being produced, local governments may be processing it improperly or simply dumping it in temporary landfills. Beijing has urged cities with at least 10 million people to set up a test site within 15 minutes walk of everyday residents. Top leaders expect local governments to foot the bill for testing at a time when local governments are already struggling, according to Nomura analysts. Expanding the model to the whole of the country could cost between 0.9 and 2.3% of China's gross domestic product. However, investing in permanent infrastructure to process what is thought to be short-term medical waste is perceived to be unnecessary expenditure. Expensive routine testing would also force governments to back away from other much-needed healthcare investments. With China not backing down from its zero-COVID policy, millions of dollars could be wasted. WION is now available in your country. Download the app now and get all the news on the move.